I mentioned this Nobel laureate Eichmann at the beginning of my talk, 1931. In 1929 he got the Nobel Prize. In 1931 he published this picture of a patient with beriberi. Now one of the symptoms of severe beriberi is heart failure, which is shown here. This is an X-ray, and as you probably understand this very quickly, if the heart doesn't throw out the blood, it becomes larger and larger because too much heart is being congested back into the inside of the heart, into the chambers. So the enlargement of the heart is a clear sign of heart failure. Now he injected intramuscular vitamin B1 to these patients, and here you can see within a few weeks the heart was pumping normal and had a normal size again. Vitamin B1. We did oral studies with oral micronutrients in heart failure patients in 2005, and 9 out of 10 patients could resume a normal life again. Well, what is the answer of conventional cardiology to heart failure? Any idea? Bypass? No. Dialysis? No. This guy. Remember? Cape Town, Christian Barnard. He was probably after Armstrong, who landed on the moon, the most famous guy in the past century. For doing what? Transplanting a heart from a patient with heart failure, or to a patient with heart failure, who survived for a few weeks. Instead of doing the obvious, filling up the cells of the heart muscle that had run dry with micronutrients. I've summarized this absurdity in this little drawing. It's like you running up with the last drop of gasoline in your tank to a gas station and say, "Hey guy, fill me up my tank." And he says, "Filling up your tank? We're going to exchange the engine." That's exactly what the answer of today's cardiologist is to a patient with severe heart failure. Absurd. This is a book I wrote on all those things, on heart disease, heart attack, stroke, irregular heartbeat, high blood pressure, heart failure, diabetes, cholesterol, and much more. You can go online and read it online, download the chapters you want, etc. Cellular medicine and AIDS, that's the last disease I'm going to be touching on. It is a huge public issue. It's a huge public health issue, and it is a tragedy what is going on. As you know, probably, we do have a branch of our foundation in South Africa. South Africa is one of the countries most haunted by this epidemic. So I spent personally down there about a year and a half, and consider myself rather knowledgeable on what's going on. But here you see the very same mechanism like we've got to know it with cancer. The antiretroviral drugs, which is the chemotherapy for AIDS, is nothing else than chemotherapy for cancer in pill form. Most of these drugs are simply the same ingredients packed to be swallowed like chewing gum. Remember, from chemotherapy in cancer, it destroys the immune system, you get infections, and so on and so forth. It destroys the immune system. Excuse me? You're having a disease that is called acquired immune deficiency syndrome, which is characterized by a failing immune system. The patient comes to the pharmaceutically educated doctor, diagnoses HIV, and the answer he gives is a drug that first and foremost attacks the bone marrow in the immune system. What do you make of that? I've summarized it in this picture. Here's the bone marrow. That's the sternum here. The production site for, the major production site for our immune system cells, white blood cells. They are divided into different types, which are called neutros, monos, lymphocytes. Now, from those 9 Nobel Prizes, about half of them were given for uncovering or for discovering the role of vitamins in stabilizing, enhancing, optimizing the immune system. So the role of vitamins for the improvement of immune system is no question. It can only be doubted by someone who moved himself out of science altogether. But instead of promoting vitamins to fight immune deficiencies, our friends from the pharmaceutical industry, they are promoting chemotherapy that attacks the immune system in addition to this being already weak. And they're selling this as cure or treatment or whatever. If you think chemotherapy is already a scandal, you need to think new about the dimension of unscrupulous businesses when you talk about the pharmaceutical business with AIDS drugs. Here are the statistics. The global report of the WHO on HIV/AIDS, published in 2001, after a quarter of a century of the AIDS epidemic, shows that if you are HIV infected and you do not take ARVs, your chance of being alive after 13 years is 80%. The available studies that have been conducted with ARVs calculated on 13 years show that if you take ARVs, your chance of surviving those 13 years is essentially 0. This scam only works by our friends, the gorillas, making an equation between HIV and AIDS. And then telling everyone HIV is a highly aggressive virus that kills people. Well, the statistics of the WHO tell us otherwise. If you are alive after 13 years, this virus is neither highly aggressive nor deadly.